Our next speaker of the session is Abhishek Kumar. Abhishek is here to discuss with us about REM sleep behavior disorder and its relation with the Parkinson's disease. Let's hear from Abhishek.
The title of my talk is How Enacted Dreams Could Predict Parkinson's Disease. Enacted dreams means dreams in which they are action-packed dreams in which their eye and body movement occurs. So this is a television series which came in 1940s, MASH. So I'm not going to talk about this series, but one of the actor from this series, television series actor, whose name is Alan Alda. So once he was missing from the set, and he was actually facing a life threat, which was not real, but it appeared to him so. Basically, he was dreaming and he saw some threat appearing towards him. So he saw a bunch of potatoes kept in a bag beside him, and he started throwing it towards the attacker. So when he woke up, actually he was throwing the pillow on his wife. So I'll start with, basically I'll first explain about what are stages of a sleep cycle. So basically it consists of two main phases, REM, which stands for rapid eye movement, and non-REM phases, which consist of three different stages. So during REM, rapid eye movement occurs, and this is the stage during which most of the dreams occur. And it is very much similar to the awake state of an individual's mind. So sleep disorder, basically, such as RBD, is a disorder in which people talk or move during their dreaming sleep. And it could also predict several neurodegenerative diseases such as Parkinson's disease. So RBD, or acting out dreams, they occur during the rapid eye movement of sleep, and it affects almost 1% of the general population, and it is reported to occur in older individuals above the age of 50 years, and particularly in men. So they may foreshadow neurodegenerative diseases. So they may foreshadow neurodegenerative diseases such as synucleinopathies. So this is the condition in which protein alpha-synuclein forms toxic clumps in the brain neurons. And so basically alpha-synuclein in normal condition, it is known to regulate neurotransmitter release via synaptic vesicle formation, but the exact mechanism is not known yet. And some epidemiological studies suggest that RBD could predict 80% of the neurodegenerative diseases. And of course, not all nocturnal behaviors are RBD, such as sleepwalking, sleep talking, which occur during non-REM sleep, does not fall in this category. And RBD is not always associated with synucleinopathies. It can also be triggered by some drugs such as antidepressants or other conditions such as brain stem tumor or narcolepsy. So these REM and non-REM sleep can be very easily distinguished in a sleep research laboratory by monitoring blood oxygen levels, eye movements, limb movements, etc. So one of the most common RBD-linked ailments is Parkinson's disease, which results in progressive loss of motor control, Lewy body dementia, and multiple system atrophy. So this link between disease and sleep disorder is as old as the recognition of the disease itself. So in James Parkinson's original description, an essay on the shaking palsy, which was published in 1817, he wrote that tremulous motions of the limbs occur during sleep and augment until they awaken the patient, and frequently with much more agitation and alarm. So this is one of the articles which was published in 2015, looking for Parkinson's sooner, in which many neurologists suggest that RBD is the strongest clinical prodromal marker we have. And so after reading this article, I'll come back to the MASH TV series actor. So the actor convinced his neurologist to do the brain scan after reading this article, and so his suspicion was confirmed. He had Parkinson's, and so after that he started various awareness campaign for the disease, and he says that the sooner you attack it, the better chance you have to hold off the symptoms. So there are basically two schools of thought, where does the Parkinson disease begins first, in the brain or the gut. So in the gut, the toxic clumps of alpha-synuclein first forms in the gut, and through vagal pathway they are transported to the brain. And in the brain stem, when the toxic clumps are formed, they start degenerating neurons, and it affects the sleep cycle, which also related to RBD, this condition. And vice versa in the brain model, first it develops in the brain, then the toxic clumps are transported to the gut. So generally RBD could predict a neurodegenerative disease approximately 10 to 12 years ahead, when the more severe symptoms could be developed, and it could provide a window for many clinical drugs which target alpha-synuclein toxic clumps at very early stage of the disease. So even there are many studies which suggest that along with medication, a regular exercise approximately for 6 months could also help in improving the symptoms and also protect brain cells from damaging further. So I'll summarize my talk. RBD or REM sleep behavior disorder may forecast neurodegenerative diseases, and it helps researchers to investigate therapies that target alpha-synuclein at very early stage before debilitating symptoms appear. In addition to medication, exercise also helps to improve the motor and cognitive symptoms of Parkinson's patients. So this picture shows exercise which neurologists recommend to their patients. It's called Tai Chi, which helps in improving cognition and balance in patients. Thank you.
Thank you, Abhishek. Now we have time for questions.
Abhishek, when you say the disorder helps you predict, how would a patient know that they have a disorder, or when would they approach a doctor?
Like in this case, the dreams could be a prognostic marker. Dreams or not, actually RBD means when they have action-packed dreams, like.
No, but for a person who's prone to, say, Parkinson's, I mean, how would he be able to predict that he's, like, these dreams are unusual and I should go to and figure out, you understand my point of view? From the point of patient, how would they be able to figure this out?
So themselves, like patient themselves. So of course, early signs could be, like as I told before, is action-packed dreams, and sir, which could of course it should be confirmed by a neurologist.
In many cases, we don't remember it by morning.
Yeah, that's true. That's true.
Yeah, Abhishek, I have a question. What is the differentiating criteria between REM and non-REM sleep? What you told was basically how you diagnose it. So what is the criteria, how you differentiate between REM and non-REM?
So it could be distinguished through brain imaging, like I have shown in one slide, different stages of the sleep. So your brain waves and other physiological symptoms, they can distinguish REM from non-REM sleep. And in sleep research laboratory, it is very clearly distinguished.
So apart from such laboratories, it's not possible to diagnose it?
Sorry?
Apart from research laboratories conducting research and diagnosis in these laboratories,
I think it will be better to like confirm, like brain imaging scan can also confirm it. But of course, that for that you need a laboratory.
But isn't that a very costly method?
I don't know the exact, like this. We can discuss it later on. Can give you some references.
I have another question. Regarding the sleep, again, the different stages of sleep. If your sleep cycle is not very strict, then does these different phases change? Suppose in general you sleep at 11 o'clock, then one day you are sleeping at 4 o'clock. How does these phases change in such a scenario? And does it have any effect in cases like what you are predicting?
Yeah, so the sleep awake cycle, if that sleep awake cycle is disturbed, it could have also impact on your physiology, such as memory, your alertness, etc.
Thank you. Thank you, Abhishek.